Welcome everyone. We are here tonight. An excellent class. Erectile dysfunction is the actual topic. It's going to be a great class tonight. Hopefully everyone can hear me. Looking forward to it. I'm so happy that you all are here. And we are going to get started. So the first thing is, like I said, the subject is going to be erectile dysfunction. What I'm going to go over tonight is basically one, what is erectile dysfunction? Bang. Two, what causes erectile dysfunction? And three, how to allow your body to heal erectile dysfunction. Erectile dysfunction is something that I've had in the past. I totally eradicated it and I'm back to normal like I was when I was a child. And so I'm going to be able to share that with you. And everything, the majority of things that I share with you when it comes to healing are things that either I've been through or that I've helped other people heal. And so I know that it works. When I'm telling you, I know that it works. So it's going to allow your body to heal, because when you give the body the right nutrition, it's going to do what it's supposed to do, and that is heal itself, okay? And so we want to make sure that you're healing, that we're all healing, that everybody is getting the benefit of healing themselves, okay? So, again, I want to give a shout out to all of my Patreon members. I want to give a shout out to all of my Patreon members, and a shout out to all of my YouTube subscribers. We appreciate you. Please make sure that you subscribe. Right? Please make sure that you subscribe to our channel. All right. And make sure that you are subscribed so that you can ask questions. It's going to allow you to know when we're going live, and it's also going to allow you to be able to chat in the chat. Okay, so that's very important. Now, the other thing that I want to go over is what day and time are we here. We're here from Sunday through Friday. We're here from Sunday through Friday, 7 p.m. Okay, starting at 7 p.m. Central Standard Time, all the way through to and it can just go until, okay? And so we look forward to your questions. We look forward to your participation, and make sure when I ask questions that you're trying to answer the questions, because it's going to help you to memorize and maintain. As a matter of fact, my new book, the version of my book, it now has questions and answers in the back to make sure that you retain the information that you get as you go through the book and as you go through my health class. For those of you that have taken, or those of you that will take my health class, it's very important that you retain information. My goal, remember, is not to be able to keep you with me, but to get it so you never need me again. You're always welcome to the classes. You're always welcome to stay on my Patreon. You're always welcome to call me if you're on my walk with Daweed, and you're always welcome to, maintain that relationship. But the key thing that I want you to get is that I want you to learn how to heal yourself. Okay, this is very important. It's a very important point that I want you to get. Okay, so it's a good thing when you all are able to heal yourselves. Okay, and then how to watch the replay. All you have to do is join our Patreon, patreon.com/health class. We have a 7-day free trial. Those will give you the YouTubes and the full replays of the YouTube. The next thing that we have is the Patreon, where you can well, that's great. I'm glad you enjoy the health class, Billy. That's great. I'm so glad you enjoyed the health class. So, that's great. Yeah, we just had a great health class. Just so y'all know, we just came out of the last class yesterday. It was an outstanding health class. It went really well. So that part 1 and part 2 was really good. And in part 1 of that class, I had chills because of the conversations that we were having. So if you're on my Patreon, you can rewatch part 1. I'll be uploading part 2 of that, and that will be available for all my Patreon members in the health class and above tiers, okay? So you can always join my Patreon. That's how you get to be able to watch the replays. You can watch all my videos if you get the health class and above tier, okay? So with that, I'm going to continue. I'm going to pull up the disclaimer, and I'll be right back with the class.
Disclaimer. The information contained in this video is intended as an information resource only and is not to be used or relied upon for any diagnostic or treatment purposes. The video's information does not create any patient-physician relationship. Daweed Yisrael makes no representations about the accuracy or suitability of this content, as scientific and medical information updates and changes daily as more substantial information is discovered. Daweed Yisrael and any business associated during this video shall not in any event be liable for any direct or indirect damages, losses, injuries, or liability whatsoever suffered as a result of your use or misuse of this video's content. Use of this video is at the viewer's sole risk.
All right, guys, so we're back. We're going to have a live class today. Super excited, and it's going to be erectile dysfunction. As I stated, this is something that I've been through personally, so I know exactly how to heal it or allow your body to heal it. We don't heal anything. We allow the body to heal. We let the spirit come in and let the oxygen go where it's supposed to go so that the body and the spirit can do all the healing that is necessary. All right, and we want to make sure that we are clear on that. Okay, so again, I want to share with you all the testimonial, just because I always like to do third party. I don't like to brag or do anything like that on myself. I allow others to do that, as the scripture says, and so we'll give a third party testimonial so that you all can see the power of the course. Yeah, Go ahead.
Being here is even bigger than I could even articulate, and I think this brother's chosen to share a gift that he's been blessed with. I already knew I was the most ignorant person, but this brother never judged me. I came clean with my errant ways, never felt judged, and I'm leaving feeling better on so many levels, and I'm so thankful for him and his peers that showed up. So I'm looking forward to being back next week to gain some more knowledge, and I can pass that on to my grandchildren and hopefully anyone in my circle. But I'm going to grow with him if he allows me to, and I'm grateful.
Absolutely. You grow with him. All right. So, again, join our Patreon. Make sure you do that. Make sure you subscribe if you have not subscribed, right? We want to make sure that you do that. And we want to welcome everyone and say thank you so much. We're going to jump right into our class now, okay? And so basically, erectile dysfunction, that is what we're going to talk about today, all right? And I think everybody's ready for that, super excited about it. So let's go ahead and get right into it. So erectile dysfunction, okay? Erectile dysfunction is what? ED, also known as impotency, okay? Is the inability to get or maintain an erection firm enough for sexual intercourse. It is a common condition, and that's in this society. It should not be common, right? If we go scripturally, we know Abraham, he had children all the way up to he was 180 years old, I believe, when he had his youngest child. And Sarah also, and I'm going to talk about on Wednesday, because tomorrow night we're doing meditation, our meditative class. So on Wednesday, I'm going to talk about the female sexual dysfunction. Okay, so it's called FSD, and so both male and female. But Sarah was up in age too, when she had her final child. So these are things that we are able to do. You don't have to become impotent. Always, everything that's going on in your body is some form of what you're putting in it, which is causing a mental illness. Okay, and that mental illness will then exacerbate into a spiritual illness, and so we're all the way clogged up, in other words, and this is what's causing ED. And I'm going to share with you what I mean when I say that. Okay, because I know how to heal it. I've healed it. And I was really down. I was really, let me break down exactly so you all can see what it is that I'm talking about, okay? So the first thing I want you to get is that I was at a point where my urination was down to about 40% stream, okay? So I want you to be clear. I had UTIs, okay, as well, which is urinary tract infection. I had a urinary tract infection. I had that. I had leaky gut at the same time. All right. And this is where foreign bacteria can get into other areas of your body, which is automatically going to cause disease. Okay. You never want leaky gut. It's terrible. It causes brain fog. It's a lot of things that happen when you have leaky gut. So leaky gut, I had leaky gut as well. and therefore I had ED. Okay. And with what I'm going to share with you tonight, I basically got rid of all of those issues with one fell swoop. And this is key. And I want you to understand how important what I'm going to share with you tonight is. Okay. It's extremely important. It's going to get rid of almost every single issue that you have in your body, approximately 80%, when you understand the concept that I'm going to share with you tonight. So get your people on. If you got people that you know need to be on this, because unless they're on our Patreon, they're not going to be able to see this full video, and they're not going to get all the answers. Okay, but it's important that you get the answers on this, because this can change the course of your life on what I'm going to share tonight. And erectile dysfunction is caught up in the midst of it, and it's a very strong sign that you have a lot of issues going on in your body when you get to ED, even if you don't know it. If you're having erectile dysfunction, that means there's a major issue as far as your health is concerned going on in your body. Okay? So it's a major sign. All right? So erectile dysfunction, also known as impotency, is the inability to maintain an erection firm enough for sexual intercourse. It is it has become a common condition that can affect men of all ages, but it's more likely to occur as men get older. The only reason it gets older is because we've accumulated more crap in our colons and in our blood system and in our arteries. Okay? We've just accumulated more crap. But it can happen at any age, because right now, those children are accumulating crap because they don't have parents. Right? They don't have, and the parents haven't learned common sense or the way to eat properly. Right? Which would be our common sense, but we've lost our common sense. Okay? So due to that fact, ED again is showing up younger and younger. However, you can get rid of it, and I'm going to share with you how to do that tonight. All right? This class right here, it could not be more important. All right? If you have not subscribed, please make sure that you do. Subscribe to the channel, because it's going to allow you to be able to chat, ask questions, or anything like that. So erectile dysfunction can be caused by a number of factors, including neurological, hormonal, and vascular disorders, chronic diseases, side effects of prostate cancer treatments, psychological issues like anxiety, depression, or performance concerns. And what most don't recognize is that all of these issues, including the psychological issues, are based on what you're putting in your body. Okay? They're based on that. There can be external factors, but the majority of them are going to be based off of what you're eating, because you can handle stress. The better your physical health, quote unquote, physical health, the more you're going to be able to maintain and be able to handle anxiety, stress, and depression. The more your mental health, which is the meditation side, the easier you're going to be able to handle anxiety, depression, and performance. Okay? So what you're putting in your body has a major, major impact. As we showed in the health class last night, when I showed with the brother with the how the omega-6, omega-3 balance changed his entire life from being violent, crazy, anxiety, couldn't hold a job, and all that, to now being able to be a successful successful individual in this society, right? So that was very important to get, and so I was super happy to see that. And when I learned that most of the crazy that's going on in the world is based on our nutrition, ED is also based in nutrition, and I know it because I healed it through nutrition. And this is the key, okay? So I'm going to share with you tonight what causes it, and then how we're going to heal it, okay? Or how we're going to allow the body to heal it. Again, erectile dysfunction is a common condition now. It's now common. That makes it difficult for man to maintain an erection. It can be caused by various factors, including physical and mental health issues. So physical health, erectile dysfunction can be caused by physical health issues like diabetes. So diabetes can cause it. Okay? I want you to pay attention, because these are all related when you understand diabetes. I just did a video on diabetes, type 2 and type 1 diabetes. You can go back and watch that in the Patreon. High blood pressure, right? The high blood pressure, right? High cholesterol. I want y'all to pay close attention to these statements. Heart disease, obesity, smoking, and vascular disease, right? It can also be caused by nerve damage from diabetes, multiple sclerosis, spinal cord injuries, or pelvic operations. Now, this right here is different. Why? Because now you have to rebuild nerves. But your body will automatically rebuild nerves and all of that if you can lighten up your liver and allow it to heal. All right? Now, mental health. ED can be caused by mental health issues like depression, anxiety, stress, relationship problems, and performance anxiety. Now, I'm going to explain to you. A lot of people don't recognize this. However, when we're dealing with anxiety, right? When we're dealing with anxiety, we're dealing with, or depression, is always what you're putting in your body. Depression and all thoughts are a chemical reaction. All emotion is a chemical reaction, right? So if that's the case, you have to find out why you're having the chemical reaction. And the reason you're having the chemical reaction is because you're putting something in your body that does not belong in it according to our physiology. That is the reason that's happening. Okay? Now, especially if you're using medications. Why? Because the side effects of many medications is suicide, depression, anxiety. It can increase stress, right? So I want you to get is what you're putting into the body. Now you have relationship problems. Relationship problems come, again, because of a mental issue. Some way you're not able, or the other person can have a mental issue, but if they're showing up in your space, they're just a reflection of you. So if they're still in your space, or if that relationship issue is in your space and you haven't cleared yourself, which is something we deal in our meditation classes, right? If you haven't cleared yourself, then what's going to happen is you're not going to be, when that moment shows up, you're not going to be able to be in a state to be present in the moment. And you need to be present in the moment in order for you to be able to keep a clear head during what would be considered to most a stressful or depressing or anxiety situation. Now, if you have ever noticed, if you have moved from a meat-based diet to a vegan diet or a vegetarian diet, even if you just come down to a vegetarian diet, you will notice that your anger levels, your emotional levels, your all of those levels as far as your reactionary levels, they all come to a much lower head, meaning you will be a lot more emotionally balanced as you begin to change your living. So, for instance, I was when I was on meat, I was always this, that, da, 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 da. You know, it was like I was violent, right? I always like to have fun. I wasn't so much angry. There was times I would get angry though. And if I did, I would click, right? But once I got down into started becoming a vegan and so forth, I noticed that my aggression levels, as a matter of fact, when it first happened to me, I considered it weakness. I was like, I'm weaker with being vegan. Like I wouldn't, like if something happened, I would have let stuff ride that I normally would not let ride. Like I would, like if something took place, I would click like, nah, you ain't doing that. Or no, da da da. You know what I'm saying? Now I would let stuff ride. But then I found out that was a strength, because when you're able to see an entire situation play out, it might not have been necessary. It might not have been necessary for me to just lose my mind, right? Which is a mental illness, right? My anger clicking in, that's a mental illness. Okay? So instead of allowing my mental illness, I was now reserved. I could actually be more Elohimly or godly, right? So now I was able to grow from that. And this is what I'm saying, that what you're putting in your body makes all the difference in the world for what is going on in your life. Okay? So it's very important. So ED can be caused by mental health issues like depression, anxiety, stress, relationship problems, and performance anxiety. Hormones, low testosterone levels can cause erectile dysfunction because testosterone is necessary to maintain an erection. This is going to be key also. Remember this point. Testosterone, right? Testosterone, excuse me. I said it wrong. Testosterone is necessary in men. You need it. Do not think you do not need testosterone. That's a good thing for men. Okay? You want that. And you need it. All right? So you need testosterone, but you don't need it super high like what they're going to talk about, more than likely what they're saying. You need it at a level that's regular. Now, I'm going to be clear with you. I'm a live foodist. And now my erections is harder than when I was eating meat. Right? I can go longer, I'm harder, all of that than when I ate meat. Period. Right? Because now I learned how to clear out the body that allowed me to be able to have an erection, and that's really dealing with circulation. So have my blood circulating through my body 10 times better than I've ever had it been able to in my life. Right? So my blood is circulating properly now. Okay? ED is treatable, and there are many options that can help. So they're going to give you the medication route. We're not going with the medication route. And I'm going to tell you, do not take Viagra. Okay? That is dangerous. All of these are dangerous. When you read them, study the side effects. Whenever they give you a medication, all I want you to do is read the side effects. When you get done with the side effects, you're almost going to realize you're safer with ED than without it. You know what I'm saying? Than if you're going to take the medication. People died on these drugs, right? So we want to be very careful with these drugs. You don't need them. We can cleanse you and get you to the point where you will be right back where you were in the beginning. And I'm going to talk about that tonight. All right? Lifestyle changes, getting more exercise. Yes. Losing weight. Definitely want to lose weight. Okay? These are going to help, but they're not going to finalize the process. Okay? But they're going to help. All right? Stopping smoking and changing your diet can help. Absolutely. Stop smoking is definitely going to help. Changing your diet is the key to the game. Okay? Now, treating underlying conditions. Treating an underlying condition such as diabetes or high blood pressure can help with ED. Correct. But how do you do that? Right? If you didn't watch my diabetes or high blood pressure videos, go to the patreon.com. Make sure you watch them. Emotional therapy. Treating emotional issues such as relationship conflicts, depression, or anxiety can help with AD. Yes, it will. But the key thing when you're talking about an emotional issue or a psychological issue with ED, usually you're only going to have that problem not with multiple women. You're going to have that problem with a specific woman or a set of women that have a personality, that you have a psychological issue with their type of personality, or a person that you have the issue with that person. Okay? Where you don't feel comfortable having sex with them. But you don't have a physical form, meaning you could get hard if it's the right woman there. This is different. This is still, they consider an erectile dysfunction. They still consider it that. However, This isn't something this is different. It's the same, but it's different. And when I say that, I mean your physical body can get hard. I was at the point where my physical body could not get hard. There's many men that physical body, even if they have the thought and want to have sex, that it cannot get hard. When you have a psychological block, you're not trying to get the physical body hard. You don't want to do it. That's different. That's a relationship issue. That's a mental illness issue. And a lot of times that comes with PTSD too. So if you've been in the military, been through war or something like that, it can come with that for men, especially. Right? And you are worthy. And I want you to understand, if you got PTSD and you've been through war and all of that, I want you to understand, my brothers, you are still worthy. You are worthy. Do not feel no way that you're not worthy. You are worthy. You deserve a woman. You deserve a wife. You deserve a life. And you can turn all of that if you listen to my, as I come through the creation series classes that I'm going to be doing on Fridays, you will understand what I mean. Because you're going to be able to wipe the slate clean again. And this is the key. And so a lot of times that happens, right, with that, okay? Yes, drinking, Jerry, you are correct. Alcoholic beverages over time will cause erectile dysfunction because, and what's so deceitful, remember in the creation series I dealt with, wine is a mocker, right? And he that is deceived thereby is not wise. Why? Because when you first start drinking alcoholic beverages, it makes you hard. But when you continue over years, it starts to deteriorate and make it hard for you to get an erection. Okay? So it does, you're right. Exactly. And it does the same for women also on another level, on a different frame of or frontier, but it does the same thing. And I'm going to talk about that on Wednesday. FSD. So ED is a chronic condition that becomes more and more common with age, but it should not. Okay, remember, age has nothing to do with health whatsoever. Age has nothing whatsoever to do with health. Okay, but it's not a natural part of aging. If you have ED, you should tell your doctor so they can help you find a treatment that works for you. Okay, so this is key. So if you have ED, you should, not to a doctor. You could do that if you want to. I never say don't go to the doctor. I don't. That's all I will say. I never go to them. But if you choose to, you can. But I'm saying, in reality, you can heal it yourself and allow the body to heal with what I'm going to teach you tonight. Okay? Now, because I said I've done it. So I'm not going to tell you something. I'm not reading from a storybook. It's not a storybook idea. It's not like a, hey, this, and that idea. This is a real idea. It's the real deal. Okay? Now, we're going to go through it. This is Mayo Clinic, right? So, again, erectile dysfunction, impotency is the inability to keep an erection firm enough for sex. Having erection trouble from time to time isn't necessarily a cause for concern. But it is, in my opinion. I don't agree with that. If you have if it starts and you're having problems, that's where you want to catch it. Okay? You want to catch it right there when it starts happening. Okay? If you catch that you're not able to get hard like you used to, and you might sometimes and not others, there's an issue going on. Okay? There's an issue. And it starts just like that. And that's something I found about all disease, even my heart attack, even before I had my heart attack. It started slowly over time. And like I said, when I was exercising, it was like I couldn't push through. Like, you know, when you get your pulse rate going and it gets up to a certain point and I couldn't push through. I couldn't push through. Like my heart, I could feel it. That went on for about 2 years. before I had the heart attack itself. So these things are going to show. There's going to be symptoms that show up in any area of quote unquote disease, right? In any of those areas, those symptoms are going to show up that are going to let you know there is a problem early. They're going to tell you early. This is why we want to stay within the optimal limit, because it's going to eradicate the problem. Okay? So we want to definitely do that. Now, if erectile dysfunction is an ongoing issue, however, it can cause stress, affect your self-confidence. See, this is where all this comes in. All these mental health issues. Because why does it cause stress and affect your self-confidence? Because this society taught you, as I talked about in The Power of the Man, which was the last creation series portion I did, because if you, in this society, you have been trained, and I'm going to deal with that deep this Friday. You have been trained, right, that that you are a buck, that the man's purpose, one of his main purposes is sex, right? And you've almost 90%, especially when I was growing up. It's less in this time, but it's still very strong now. But you affect, like, your self-confidence is so low because to be a man, you were taught you have to be virile, right? And I gotta be out and I gotta be able to have sex and make her do this and da 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 da. And you know what I'm saying? We were taught that. So when this happens, when ED happens, if you haven't come past and pulled yourself out of these societal lies and deceits that say this is what makes you a man, if you haven't come outside of that, you're going to have a very low self-esteem, and you're going to lower your self-confidence, which is going to cause stress, because now your wife or another significant other or whatever, you're always worried about what society's going to think about you due to this fact, okay? And it's going to contribute to relationship problems, because now you're going to be trying to find ways out of having sex because you don't want your wife or significant other to know that you can't, right? So now this is going to cause relationship problems, okay? And now the wife is going to think you just don't want to be with her and da 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 da. She's going to go through all that. So you're going to have a whole breakdown in the relationship just because you feel uncomfortable being able to just tell the truth and then rectify the situation. Okay, so we want to rectify this situation so that we can get through it, and we're not going to do it with drugs. We're going to do it with health. And I can promise you, if you have ED, if you do what I tell you, it's going to come, you're going to be good. Okay, so I'm going to let you know that. Now, problems getting or keeping an erection can also be a sign of an underlying health condition that needs treatment and a risk factor for heart disease. Okay, that's what I was telling you here when it says having trouble time to time. Yes, it is. That's when it's telling you this. An underlying health condition is showing up. Okay, so if you're concerned about erectile dysfunction, I ain't worried about that. Even if you're embarrassed, this is the thing, this is what I was just talking about. Sometimes treating an underlying condition is enough to reverse erectile dysfunction. Okay? Now, let's continue. Symptoms. Erectile dysfunction symptoms might include persistent trouble getting an erection, trouble keeping an erection, reduced sexual desire. Okay? Now, it starts with trouble getting it. You still can get one, but it ain't like it used to be. And you know the difference. But when you get it back, buddy, I'm going to promise you, man, that mug be harder than you ever had it. Even as a little kid, I mean, it's hard. Like, it'd be like, man, like, whoa. So that's why I'm saying, like, when you get it back, you're going to be like, man. And you're going to understand what was causing it. And I'm going to share it with you in a minute. And then trouble keeping an erection and reduced sexual desire. You don't always have reduced sexual desire. You just can't get it up, right? But if you have reduced sexual desire, that's going to be more of a mental. Okay, and that's where you need the clearing meditation. Really need to just get on my Patreon, the tier where it's called Getting High with Dawid. And I deal with the meditation, I deal with the mental health, and the creation series. This is going to help you to be able to clear, right, whatever is causing that side of your issue, right? And I did clear. I also cleared before, let me think. Yeah, way before. I cleared way before I did this. Before I actually fixed my erectile dysfunction. Okay? Now, let's continue. Causes. Male sexual arousal is a complex process that involves the brain, hormones, emotions, nerves, muscles, and blood vessels. It does and it can, but one thing about the man is that, and if I'm wrong, you can put it in the chat, but we gonna get hard, like you heard Eddie Murphy say, if the wind blow. If you ain't had sex in a long time or something like that, you gonna get hard when the wind blows if you have not learned how to, through meditation, learn how to deal with the root chakra. Okay? So if you haven't, but you're going to, so for us, there's two sides specifically for the man, right? We don't have to have an emotional charge in order to get a erection. It doesn't have to be emotionally charged. It can just come and you look down and you're like, man. But we also can increase it through mental thought, right? But we have it's a very physical when it comes to that as well. Erectile dysfunction can result from a problem with any of these. Likewise, stress and mental health concerns can cause or worsen erectile dysfunction. Sometimes a combination of physical and psychological issues causes erectile dysfunction. For instance, a minor physical condition that slows your sexual response might cause anxiety about maintaining an erection. See what I'm saying? So that's why I'm saying that's the societal idea on you not being able to get hard. The resulting anxiety can lead or worsen erectile dysfunction. In many cases, erectile dysfunction is caused by something physical. Common causes physical. It's going to normally be physical, like I said, because it's a physical process for us. So heart disease, clogged blood vessels, right? Atherosclerosis, major. High cholesterol. I want you to pay attention to all these. High blood pressure, diabetes, obesity, because all of these are related. All of these diseases right here are related. Metabolic syndrome, a condition involving increased blood pressure, high insulin levels, body fat and waist, and high cholesterol. Parkinson's disease, multiple sclerosis, certain prescription medications, tobacco use, Peyronie's disease, okay, development of scar tissue inside the penis, alcoholism and other forms of substance abuse, sleep disorders, treatments for prostate cancer or enlarged prostate. So when you go, that's another thing, that medication or even the surgery itself can throw it off. Surgeries or injuries that affect the pelvic area or spinal cord, and low testosterone. Okay? So now, the psychological cause of erectile dysfunction. The brain plays a key role in triggering a series of physical events that cause an erection, starting with feelings of sexual excitement. A number of things can interfere with sexual feelings and cause or worsen erectile dysfunction. These include depression, anxiety or other mental conditions, stress, relationship problems due to stress, poor communication, or other concerns, right? Which is big. And women, when you have men that might not be able to be in this situation, your husband gets in a situation, right? You definitely do not want to add stress to the factor. You don't want to come down like, well, why can't you get da 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 da? That's like, that would be like him physically slapping you in the face, right? That would be like him physically slapping you across your face. or worse even. So I'm letting you know, you don't want to come down. You just want to be supportive, supportive, supportive. If you can get that, that's going to help a lot of things in your relationship. It's support. Support is very important. Okay? And I'm not saying don't support to the level of abuse. That's different. Don't allow anyone to abuse you. And I'm going to deal with that when I deal with relationships. Don't allow anyone, no one has the right to abuse you in any form or fashion. That goes for hustling you into trying to get you to do stuff and not do nothing, or to be able, or treating you with beating you or hitting you. I don't care if it's male or female. If you getting hit as a man by your woman, that is wrong. That is abuse. If what do you call that? Not audio, but verbal abuse. I said audio. Verbal abuse, right, is abuse. You are not to verbally abuse your wife. You're not to verbally abuse your husband at all. In no form or fashion are you to do that. Because you trying to get something. That's your ego. That's verbal abuse. Right? You are not to allow anyone to abuse you. So we always want to support each other. Now, risk factors. As you get older, erections might take longer to develop and might not be as firm. You might need more direct touch to your penis to get and keep an erection. And if that's the case, you're gonna this because age has nothing to do with health, and I'm gonna keep harping on that. Okay, so I want you to get. You might need more direct touch. If that happens, it means you have an issue. You have an underlying issue. Various risk factors can contribute to erectile dysfunction, including medical conditions, particularly diabetes or heart conditions. Okay. Tobacco use, which restricts blood flow to veins and arteries and can over time cause chronic health conditions that lead to erectile dysfunction. Being overweight, especially if you're obese. Okay. Especially if you're obese. Certain medical treatments, such as prostate surgery, we dealt with that. Injuries, we dealt with that. Medications, antidepressants, antihistamines, medications to treat high blood pressure, pain, or prostate conditions. And that's crazy because if it's treating the high blood pressure, it actually should get rid of the ED. But it don't. It don't. That means it's not what? Treating the high blood pressure for real, is it? No, it's not. Now, psychological conditions such as stress, anxiety, or depression, and then drug or alcohol abuse, especially if you're long term. That's why I said in the beginning, alcohol is going to make you do what? Get an erection. In the beginning, cocaine, like they said, you put on the tip of the penis, it's going to make you have an erection for a long time. But you keep doing it over a long term, you're going to have major issues. Okay? So it does the reverse. That's why it is a deceiver. It tricks you into thinking something and then destroys you in the long run. So what we're going to go into now is how to heal it for real.
For the rest of this video and more videos like these, you can join us at patreon.com/health class. Again, that's patreon.com/health class. And join one of our paid tiers. Any of them will do. And you join one of those tiers, you can watch the rest of these videos, the other videos that I produced, including my former health classes, which is 4 to 8 hours of information that can help you on your health journey to the top. All right. So I look forward to sharing that adventure with you. I look forward to seeing you at the top of your health journey. Peace.